Good day. This is Renisha Bowens with the Health Information Technology team, and today I'll be going over the workflow for the OB Flowsheet, which is your intake for new OB patients and for established OB patients. Jumping right in, we're going to start on the office visit screen. If you are not sure how to access the office visit screen, this is covered in our general overview, which is in a different video that you can find on our eCW training page. Now from the office visit screen, you'll notice that in the visit type here, it shows OB EST. For OB patients, you want to make sure that your visit type actually has the OB prefix in order to view the actual flow sheet. Now your check-in process is going to be the same as it is for any other patient. We're going to check mark the box, click check in/out, and check in our patient as we normally would. Okay. To actually access the patient's chart, you can do it one of two ways, which if you've gone through our overview here, you have already seen, but I will show you again. You can click on the patient name, or you can put a check mark in the box here and click View Progress Notes here. When you see the pop-up that says, do you want to carry forward current medications for training patient or whoever your patient is, you're going to enter the appropriate response. At present, it is right now August 2021. At present, clinical staff are supposed to click no. In the event that that changes, please follow whatever guidelines are provided to you by your leadership. Once you've answered that question, it brings you to what we call the OB chart or the OB flow sheet. You'll notice at the top you have the patient dashboard, which is also discussed in the general overview, but it does give you access to various other areas of the patient's medical record. Just underneath there, you have the actual name, OB chart. You have your OB summary button. This allows you to actually print or fax the OB summary, which basically shows you what actually happened during that pregnancy, if there was anything filled out. You have the RX tab, which is generally for the providers to view the patient's prescriptions that they're currently on or have taken in the past. You have your patient demographic information, some additional info such as like their language, their race, preferred providers, PCPs, this sticky note box, which allows all staff with access to the OB chart to enter notes, kind of like a post-it note. Here we have our risk assessment, so anything that is selected as a risk is listed here. Same thing with the problems, those are also listed here. On the right side, you have this PN button. PN stands for progress note. If I were to click this button, it's going to take me to the progress note view. And as you can see, the button has now changed to OB, which when I click it will take me to the OB chart. Okay. To the far right, you have the navigation band for the OB flow sheet. All of these buttons can be minimized. Let's go ahead and click OK there. It can be minimized to give you more real estate on your screen, or you can keep it there. Okay. If we scroll down, you'll notice that all of these categories here correspond to various areas down below. So for instance, we're only seeing the pregnancy list because there is no active pregnancy for this patient. So I'm going to go ahead and create a new pregnancy. That way you guys can see the entirety of the chart. We're going to click here where it says create pregnancy. Now you don't want to do this unless you've actually confirmed the patient's pregnancy via whatever means are outlined at your via the Unity policy. We're going to assume that our patient is actually pregnant So this pop-up is going to come up asking you to add an active ICD. There are no active ICDs associated to it, so we're just going to click where it says there are none, and it opens up the pregnancy. So as you can see here under preg list, you see number 1, status open. And if I scroll down, like I said before, these tabs here correspond to the entire form here. So if you decided you didn't want to scroll for days looking for a particular section, you can just use the navigation band over here on the right. Now, as for the preg list here, we can make changes to each section as necessary by clicking on the pencil icon here. Let's give it a chance to open up. All right, so from here, we can actually close the pregnancy, add any special details like the discharge date if the pregnancy is over, the father's information, the primary OB provider that can be selected from here, patient's race, father's ethnicity. Sometimes that's used for very specific information regarding the patient's or the baby's potential health. And like the tabs over here on the right, you can actually navigate through on the top as well here. So we've done assume that we were going to put information here. We would have done all of that here. We're going to jump to where it says physical. Now, the only thing, if you are an MA or a nurse, the only things that you really need to fill out here would be the patient's weight. So whatever the patient's weight was at that current visit, and the pre-OB weight. And that's pretty much it for this screen. We're going to go ahead and click OK. And that saves that there. Next, we're going to look at the EDD tab. And this is where we're going to enter the patient's last menstrual period. Now, this should have been acquired by you during their intake. So when you got the patient's vitals, you should have gotten their last menstrual period. So we're going to go ahead and enter a last menstrual period. Let's go with, this can be free typed, or it can be, you can use the calendar. And as you can see, once you enter the date, an EDD is stored. Only the provider can finalize the estimated due date. So we're just going to click OK to lock that in. All right. So as you can see, we have our open pregnancy. We have our pre-OB weight. Some of the histories will automatically pull in. We did enter the EDD, so if we wanted to jump down to the EDD tab so you can see that, that's there. But the next section we're going to look at is actually going to be the flow sheet documentation. This is where we're going to put in the patient vitals information. So let's go ahead and click the plus sign to add that in. Note, it pulls in today's date, it pulls in the time, it pulls in the encounter information as well, and the patient's gestational age once the EDD has been selected by the provider. So we're going to start with the patient's blood pressure by putting in what the blood pressure that was acquired during the initial intake. If the blood pressure was out of range, of course, you would enter the repeat blood pressure as well. Their current weight today, and then you'll see a total weight gain populate here once you put in the weight. This subtracts from that pre-OB weight that we put in earlier today. At this point, you can also add in your initials and click OK. Now, this automatically saves here. There's an additional section that needs to be documented as well. So once the patient has left urine and you've completed the urine dip, you can actually re-access this chart by clicking on the date, and then you can enter the urine values for the protein, ketones, and glucose. If any additional urine dip values are out of range or anything that needs to be of note, there's nothing here for you to put in the drop down, but you can free type it. So for instance, let's say there was a lot of blood in the patient's urine. You can put the urine dip value for that. And I'm going to click OK. And I've documented all the information that needs to go in. Okay. Now, if you have an established patient where all of this information has already been completed, so the physical's done, the patient's seen the provider in the past for a previous OB visit, then you don't need to do the physical and the EDD and all that all over again. You would go automatically straight to Flowsheets and enter the patient's vital information. So you would do the blood pressure, the weight, the urine protein, ketones, and glucose, and your initials. And then you would click OK to pull in the information. And that ends the OB flow sheet. Thank you and have a good day.